Welcome back to Family Planning and Abortion for Medical Students. Today we will continue our mini-series on family planning and contraception by talking about hormonal methods of birth control. We will continue to cover the below APGO Topic 33 learning objectives, including discussing the mechanism of action, risks, benefits, and effectiveness of contraceptive methods. I will not be covering counseling for contraception directly, but have links and resources in the course folder. This is our main learning objective for today's video. Again, here are the 5 major categories of contraception. We will be discussing what these methods are, how they work, how effective they are, advantages, disadvantages, contraindications, and other things to note. Today we will focus on hormonal methods. A more comprehensive document about absolute and relative contraindications for these methods from the CDC is in the resource guide as well. You can open on your phone called Contraception, which might be helpful in your OBGYN clerkship. Let's jump into talking about hormonal contraceptives. These include combined pills, the mini pill, vaginal ring, patch, and emergency contraception. They all work similarly, so I will talk first about their mechanism of action before getting into individual differences and uses. These methods use either just the hormone progestin or a combination of estrogen and progestin. Both of these hormones are naturally produced in differing quantities during the menstrual cycle as displayed here. There are some particular side effects of estrogen, some positive, some negative, that are present in any method using systemic estrogen, and I will highlight those in pink so they're easier to recognize. The image on the left displays the same hormones, estrogen and progesterone, as on the previous slide, but also includes the hormones that regulate them, which are follicle stimulating hormone, or FSH, and luteinizing hormone, which is LH. LH is important for ovulation, and as you can see, the level increases dramatically just prior to ovulation. On the right, you can see that when using estrogen and progestin-containing contraception, progesterone and estrogen are maintained at high levels, and FSH and LH are suppressed at low levels, and that LH surge never occurs, so neither does ovulation. This occurs because estrogen and progesterone are regulated through a negative feedback loop. High levels of these hormones cause decreased production of GnRH, which stands for gonadotropin-releasing hormone, which then also leads to lower levels of FSH and LH. While this normally then would cause lower levels of estrogen and progesterone, these hormones are being taken exogenously through the pills, thus maintaining their levels. While this is the mechanism for combined pills, just high levels of progestin on its own have some additional contraceptive effects. Progestin causes thickening of the cervical mucus to make it less penetrable by sperm. It also does not allow for endometrial proliferation, causing atrophy of the inner lining of the uterine cavity, making it difficult for implantation to occur. Lastly, it causes decreased fallopian tube mobility and peristalsis, so an egg is impaired in its ability to travel to the uterus. Now we will talk about each of these methods individually. Combined oral contraceptives are pills containing estrogen and progestin that are taken daily for the most part. Some types of pills have a couple days of placebo or a week of placebo. There are many formulations and dosages of these pills on 28 and 84-day cycles, and some for even longer. These pills work through several mechanisms previously mentioned. They're about 91% effective, but this rate is increased with correct and consistent use. Advantages include that they are easy to use, effective, provide a quick return to fertility after discontinuation, and some of the estrogen effects, as you can see in pink, that include that it may lessen some menstrual symptoms, decrease acne, and lower the risk of breast cancer. Disadvantages include that they offer no STD protection, the patient must remember to take the pill every day, and they can be rendered less effective by certain medications, such as some antibiotics. And other negatives include some of the negative effects of estrogen, which include nausea, headaches, breast tenderness, and increased risk of blood clots or venous thromboemboli. This option is contraindicated in people with breast cancer, hypertension, cardiovascular disease because of the clot risk, immediately postpartum because you're in a more hypercoagulable state, and people age 35 or older who smoke, as well as people who suffer from migraines with aura. Next is the mini pill. The mini pill contains only progestin and is taken daily at the same time each day. These pills thicken cervical mucus, decrease the endometrial lining, and decrease tube motility, as mentioned before. There is some research showing they may also suppress ovulation, but this is not consistent each cycle and is not the primary mechanism of contraception. They are about 95% effective, again, which can be greater with consistent use. Advantages include being easy to use, they're effective, and have a quick return to fertility after discontinuation. Disadvantages include that they do not provide STD protection. You must remember to take them at the same time each day, which is even more important for the progestin pills compared to the combined oral contraceptives, and that some medications may make them less effective. An additional benefit is that they can be used in patients with cardiovascular risk factors that cannot take combined pills due to estrogen. A quick side note on another method of oral contraception. Emergency contraception is used after intercourse has taken place to prevent pregnancy if the primary birth control method has failed or one was not used. Emergency contraception in the U.S. consists of Plan B, Ella, and copper IUDs. We will talk about the copper IUD later when discussing long-acting methods. Plan B and Ella are both pills that can be taken up to 96 to 120 hours post-intercourse to prevent pregnancy, but are most efficacious the sooner they're taken after intercourse occurs. They work by preventing ovulation and implantation, as well as thinning the endometrial lining. Plan B is a high dose of progestin that prevents LH and FSH secretion through feedback inhibition, whereas Ella is a competitive antagonist and blocks progestin receptors, not allowing the endometrium to undergo the changes needed to prepare for implantation of pregnancy. These methods are 87% and 93% effective, respectively. Advantages include that they are safe, effective, available over the counter for Plan B, and private from a partner. Disadvantages are that they can require a prescription or clinic visit in the case of Ella or copper IUD, and that they may cause side effects such as nausea, vomiting, abdominal pain, and headaches. They may also be less effective for patients with a BMI over 30. The next two methods are non-oral forms of hormonal birth control. They are very similar to combined oral contraceptives in terms of mechanism of action, the fact that they generally have 3 weeks on, 1 week off cycles, and in terms of side effects. The first method we'll be talking about is the birth control patch. This is when a patch containing the hormones estrogen and progestin are placed on the skin to prevent pregnancy. People will use one patch per week for 3 weeks, and then no patch for 1 week, and repeat. This method is 91% effective, more so when used correctly, meaning it's placed at the same time each week. Include that it is easy to use, you can see that it is in place, and the positive effects of estrogen as noted in pink. Disadvantages include no STD protection, needing a clinic visit or prescription, as well as the negative effects of estrogen, also in pink. Also to note, the patch has higher levels of estrogen compared to oral contraceptives, so there is a higher risk of blood clots. Last up for hormonal methods, we will be talking about the vaginal ring. This is a flexible ring that is inserted into the vagina and contains progestin and estrogen, which are absorbed locally in the vaginal mucosa. They use the same mechanism as combined oral contraceptives and the patch to prevent pregnancy. The ring is inserted and left in for 3 weeks, then removed for 1 week, and replaced and repeat. It is 91% effective, more effective when used correctly and consistently. Advantages include being easy to use, safe, fairly effective, as well as the positive effects of estrogen. Disadvantages include no STD protection, needing clinic visits or to get a prescription, increased vaginal discharge, and the negative effects of estrogen. There is also a slightly increased risk of toxic shock syndrome, which you may have recalled learning about in the context of tampons being left in the vagina for too long. This risk can be decreased by using hygienic insertion and removal methods of the rings. Thanks so much for listening. Please check out the resources for more information and don't forget to tune into the next video where we will be talking about my personal favorite contraceptives, LARCs.